Typically, when you hear the words family planning, the first thing that comes to your mind is women and children. More women than children, never us men. So today we're going to go to Ozark Area Community Action Corporation and we're going to see, is there something that us men are missing out by not going in? This POV with DC. Let's dive in. Welcome one, welcome all. I'm your host DC, better known as Damian C. This is POV with DC, where I speak on my views as far as POV, point of view, my point of view on certain topics. I want to let you know that these are my views and my opinions. Even though this video is sponsored by Ozarks Area Community Action Corporation, who we will be visiting about the topics that we're actually speaking about today, these are my views and my opinions solely only. Now, with that out of the way, let's go ahead and get to the business. When it comes to men, we don't get the light that we deserve or the light that we think that we actually have, in which we actually do have a lot more avenues for a lot more benefits than we think we do. So when you think of the words family planning, like I mentioned earlier, you typically think of women and children, more women than children, more women than anything. But today we're going to go to family planning. We're actually going to see what are the benefits for us men in there. And I'm also going to show you how easy it is to actually get in there, get tested, and get out of there, and the benefits of it. Now, what I'm going to do is I'm going to cut straight to the chase and let you know that they do actually offer testing for us men. And depending on what kind of insurance you have, it's typically free. If you're a male and you hear the words family planning and the first thing you think of is women, females, you're not alone. That's typically who it's designed for. We don't know about the window that's actually designed for us to go in there and seek help and get the same help that women get also. Now, speaking as a man for the man, when it comes to things like getting tested, STDs, STIs, things of that nature, that's one of the most overwhelming and one of the most underpowered conversations that we actually like to have because of the fact there's so much that comes with it. And a lot of men have this stigma where we feel as though if we don't feel nothing, we have nothing. All it takes is one night to ruin your life, but all it takes is 10 minutes to get your life right. Now, just to cut to the chase, they do actually have a lot of programs, a lot of benefits for us men to go over there and actually seek help, seek answers, and actually give suggestions. They can't go without us. Like they actually need us to actually tell them what's going on also. So our input is needed also. So with that being said and done, later on this video, I will be showing what happened when I went over there not only to do the things that I need to do, but actually get some questions answered that I needed answered. Before I do that, before I do show my visit over there, let's talk about a few things. Let's get a few things out the way. Now, one of the misconceptions of family planning is it's only for women. Another misconception is you only go there when you're speaking about things like STDs and STIs. That is not true. Here is a complete list of things that they actually do. Also, a lot of things they do is actually things that your primary care doctor could, should, or would do. But a lot of doctors don't want to see if you don't have adequate or any kind of insurance. So let's take a look at this list of what family planning services are available: education and counseling on your birth control options, even weight, height, blood pressure, and cholesterol checks. That has nothing to do with sexual reproduction. That has something to do with your actual regular health, something that needs to be checked on anyway. Screening and treatment for vaginal infections, urinary tract infections, or UTIs, and sexually transmitted disease, infections and diseases, STIs and STDs. Also, routine exams, including pap smears, pelvic exam, and breast exams. So that's a small list of things that they actually do there. And you can actually see that the nurse there is actually doing it with a smile on her face. So a lot of people think that it's so nerve wracking going in there, which it could be if you never went. But they're humans just like us. So when you go in there and you tell them what problems you have or what problems you think you have, they're going to do one or two things: either come up with a solution or help you find the solution. Now let's go over a few more facts and benefits of STD testing. Why testing matters. Understanding the importance of STD testing. Many STDs show no warning signs or noticeable symptoms. Early detection enables prompt treatment and care. Testing helps protect sexual partners from infections. Basically, what they're saying is the more you know, the more you can cover. So if you know that you have something, the sooner you know about it, the sooner you find out about it, the sooner you can do something about it. There is a certain time frame where certain medications cannot be as effective, and there is a certain time frame when you're speaking of STDs and STIs that if you don't attack them before they attack you, that can actually attack you, and it is pretty much irreversible. I will be transparent and say some things are not curable, but a lot of things are able to be slowed down, and some things are able to be completely erased. Who should get tested? Everybody. Like, let's go. Everybody should get tested. Like, if you're actually sexually involved, if you were sexually involved, or if you plan on being sexually involved, protect your past, present, and your future. You are a gift. So make sure that that present that you're giving is actually a present worth giving. Also, sexually active adults, people with new partners. General rule of thumb is no matter how much you know a person, you typically should still be getting tested every 3 to 6 months or every time you have a new partner. It's just rather be safe than sorry. That's why these programs are here, to make sure that you're covered, to make sure that you're safe, to make sure that your well-being is being taken care of. Anyone with symptoms or exposures, we've all had those nights where we didn't wish we had those nights. That's what things like here are for. So that's why it's best, like I keep mentioning, to go there and actually get tested, get those results, and get those rapid results also. There's a lot of things that before you leave out, you would actually get the actual test results right then and there before you leave. Sexually active adults, anyone with symptoms, people with new partners or exposure, it's just best to get tested. What testing includes urine, blood, and swab tests. Now, that doesn't mean that they're going to go and take a gallon of blood out of you. It's literally just a little poke. I actually showed that in the video later on. And frequency depends on risk. So the more you're active, the higher your risk is, even if it's with one person. So that's why we really push that it's good to get out there and get tested. Also, test for HIV, chlamydia, gonorrhea, and syphilis. So you definitely want to get tested for those things. They would definitely do a full screening. The more you ask, the more you can find out. Because like I mentioned earlier, most STIs have no symptoms at all. The earlier the detection, the quicker it can be canceled out. Making testing routine. Take control of your health and your well-being. It's literally that simple. Like, this is your life. You only get one. And some things are irreversible, but some things are able to be reversed. Time can never be reversed, but something trying to attack your immune system or attack you can be. In most cases, as long as you are taken care of, no one will look down on you. I think one of the biggest issues that people have is that they feel as though if they do have something, the world would know. No one would know. No one will know. Your friends and family will only be notified if you want them to be. No one will know. And testing is a normal part of taking care of your health. It's no different than going and getting a flu test or a flu shot. So keep that in mind also. Now, as promised, I will show you me going to Ozarks Area Community Action Corporation and me actually showing you the ins and outs of what I could show you. Again, I did get the ability to record in there, but due to patient privacy, I wasn't able to record everything. So, with that being said and done, here we go.